Go into slideshow. Okay, so let's start with, first of all, did everybody get the, the zip drive I sent? So what's on the zip drive is the key points and also the audio key points. So a couple editions ago, in the 6th edition of your textbook, they made recordings of all the audio points, or of the key points. So I sent those to you for these chapters, so you can listen to them while you're working out or whatever.
So can I just ask you, so we have the 9th edition, and a lot of the stuff is coming from the 8th, most of it's coming from the 8th edition, and I've done both study guides, 8th and 9th, a significant difference, like almost like 10 or 12 different questions on the study guide that they completely change around or add stuff to, or
Right.
even change. Is it possible that you could post the review concepts or the study guides for the 8th edition? Because we don't have access to it. No, not the study guide.
The key points? Yes, most definitely. I can do that for you. And yes.
It would be really helpful.
Yes. I can also show you how to get them, I believe.
That would be awesome.
Okay, so come see me.
Yeah, because they already gave us the 8th edition study guide and the workbook, so that was really helpful, but the key points, they have a little bit more stuff in it than the study guide.
Okay, and then the key points that I sent in that zip drive are from the 6th edition, so they're going to be different again, but it's still good content, and the audio is kind of nice to have so you can, oh, there's that silly thing again. Okay, so they told me they fixed this, but they didn't. We're going to keep the current color scheme. Everybody happy with that? Okay, so let's start our study guide or scenario, case study. So Sam, he's an interesting guy. He's 69 years old and he owns his own business. And the stress overseeing his employees, meeting deadlines, and carrying out negotiations had led him to poor sleep habits. He sleeps 3 to 4 hours a night, and he's not in nursing school. And he keeps himself going by drinking 2 quarts of coffee and smoking 3 to 4 packs of cigarettes per day. He weighs 280 pounds, but he does not use alcohol. His wife complains that his snoring has become difficult to live with. Oh, poor Sam. Okay, so let's talk about Sam. The clinic nurse, as a clinic nurse, what routine information would you want to obtain from Sam? How many years have you smoked? What medications are you on?
Have you been evaluated for sleep apnea?
Have you been evaluated for sleep apnea? It's all on there. Did I give that all to you guys?
No, I just wrote it down.
Oh, good for you. What else? Anybody else have any things you'd like to ask Sam about?
When does he stop drinking coffee?
What time of the day do you start drinking coffee? What other pre-existing conditions do you have? Yeah, do you ever have skipped heartbeat? What about, okay, so what other information can you get? Objective information can you get from him? Maybe with some of your equipment. Vital, thank you. Vital signs, that would be good. Oxygen saturation, let's check what his sats are. We know he's smoking a couple packs of cigarettes a day. Medical history, like Josh said. Environmental factors, where are we? Where does he work? Does he, is he in a smelting plant? Like, I don't know. I like that word, that's why I use that one. Any pertinent nasal problems? Anybody that, oh, hey, Josh, before you got your septum fixed, did you snore? No. You never did? But that's common with deviated septums to have some snoring problems. So any kind of congestion, any nasal problems. And then allergies, because allergies congest us, so we snore with allergies. Any current medications he's on, any over-the-counter medications, as well as herbals. We need to know about those too. And now that marijuana is legal, we need to know about that as well.
I feel like that needs to be like a routine.
Sure, we should be asking that. Because especially for someone with respiratory, how are they ingesting it? Right? They should do edibles instead. Is that what you're recommending? Or vaping. Vaping still is affecting the lungs, okay? The only thing that's meant to go into our lungs is pure air. Okay, so after interviewing Sam, you report following information. He has a blood pressure of 164/90, his pulse is 92, respiration's 18, SATs are 90. He's under considerable stress. He's gained 50 pounds in the last year. Oy. Has a history of tobacco and caffeine abuse. He complains of difficulty staying awake. He wakes up with headaches most mornings and has mid-morning somnolence. That's another good word, somnolence. He is depressed and irritable most of the time and reports difficulty concentrating and learning new things. He's been involved in 3 auto accidents in the past year. What's going on with him? Lack of cerebral perfusion as evidenced by, right, all these things. All right. So your examination is normal except for multiple bruises over the right rib cage. He's bruised up on the right rib cage. And you say, well, how come you have so many bruises? And he says, well, my wife jabs me at the elbow several times every night. And his wife says, well, he stops breathing and I get worried, so I have to wake him up to make him start breathing again. So you suspect sleep apnea. Now, has anybody ever slept with someone or been around someone who has sleep apnea? Okay, so it's significant. You can tell when they're not breathing. Right, so it's this quiet, right? Okay, so that's what they do. I have to tell you this story. So, I just went on a trip with my 3 older brothers, some of the geriatric boys. So we were on a cruise of the Baltic Sea, and we had 2 cabins and a shared balcony. My oldest brother and my youngest brother were in one room, and I had to deal with the middle one with me. So, I lost out. Oh, I'm on recording too, so I better be careful. So my oldest brother is there with my younger brother, who's deaf, well, sort of deaf. He has hearing aids and pretends not to hear us. And Jim comes running over to me like this through the balcony. He's like, you got to come in here right now. And Bob's sleeping, so I come in to see Bob, and he's like, and all 3 of us are standing around Bob. He goes, he's doing this over and over. I'm like, he has sleep apnea. And all of a sudden Bob goes, and breathes. So I've had, I get on the phone and everything to my sister-in-law when we get back. I'm like, this is what he's doing in his sleep. She's like, he's been doing that for years. I'm like, I know, he's got sleep apnea for years. His life will change if you get him on something, get him a machine. I'm not wearing one of those damn machines, so he's not going to do it, but partners always know. So 2 main types of sleep apnea and the pathology of each. Anybody got any ideas of that? There's obstructive sleep apnea, which is what we see all the time. And what is obstructing? It's the airway collapsing upon himself. There's also central sleep apnea that's very rare. And now I have to look at my notes so I can tell you just how rare it is. Central sleep apnea, less common. The brain actually fails to send appropriate signals to the inspiratory muscles, and there's no respiratory effort. So that is a total different thing that, it's very scary, that one. Oh, I don't know if I can link that to that. No, I don't know. We'll ask somebody else, somebody who knows. Okay, so central sleep apnea and obstructive. And obstructive is what we see most often. Early recognition and treatment are most important because long-term side effects of sleep apnea can include an MI, arrhythmias, hypertension. It continues over a prolonged period of time, which is going to happen to my brother because he's not wearing one of those damn machines. Pulmonary hypertension, you can get right-sided heart failure. Polycythemia, why would we have polycythemia? Think about that. Sleep apnea, develop polycythemia. Because the body believes it's not getting enough oxygen. So how can I get more oxygen? I'm going to build some more cells to carry some more oxygen, right? Polycythemia. And strokes, somebody already mentioned that. Diabetes is also associated with apnea. Now, diabetes is probably, in my opinion, the worst disease there is because there's so many things affected to it, with it, and it affects everything. And controlling your diabetes there's some linkage where there's some studies where sleep apnea is controlled if the sugars are controlled. So that's kind of interesting. And there is a hypoventilation syndrome, and that type of apnea is more common for people who are on narcotics or benzos. So we're seeing that with the opioid issues that we have. So we'll also see that there. So 5 signs or symptoms of obstructive sleep apnea, and which ones does Sam have? Okay, I love this picture because he has that receding or small jaw. Now, I always call them the turtle man, or the turtle people. Not Turtle Man from the show, the kooky Turtle Man show, but, their head kind of like a turtle. They don't have a chin. You know what I'm talking about? Like people, you've seen them. They don't have a chin. They have a recessed jaw. So they're more likely to have sleep apnea just built on because of their anatomy.
Silly question. If they were to have their jaw fixed by going through open function, would that solve that issue?
Maybe. Maybe. There's all sorts of things we've tried to fix sleep apnea. Some of them don't work. So look for Turtle Man. This is one of those crows that you get to see. Okay, so now it's time for me to tell that story. What are you laughing at? Okay, so how many crows did you see when you came to school today? None. When you walked out of your house, how many crows did you see? When you're driving over here, did you see any crows? You saw some birds? You saw some crows when you came out? Yeah, sort of like over here in the periphery, but you started to notice them? Okay, so when I was walking in here, I actually saw 2 crows. I even mentioned them when we walked in because I was doing something else. But so crows are everywhere. Crows are around. You notice them or you don't, but they're always there. You walk from here out to your car, you're going to see a crow if you're looking for it. So crows sometimes are way out here in the periphery. Sometimes they're flying right in your face. Sometimes they're yelling at you from the trees. Crows are everywhere, right? Look for crows in your patients. Sometimes it's just going to be the way you can hear them breathing. Sometimes they're going to be so apneic it's in your face. Sometimes there's a whole bunch of symptoms together. A lot of crows are flying straight at you. Sometimes it's only that one that's way back here. So always look for crows because you're going to be able to pick up on things early if you look for the crows. So the crows are the signs and symptoms of obstructive sleep apnea. So with this guy, what do you think he has? He's obese. He's a turtle man. We think this guy in the picture definitely is Turtle Man. He has a cessation of respiration during sleep, usually followed by gasping for breath. We know his wife has told us this, and he has the bruises to prove it, right? He's tired during the day. He's had how many car accidents? 3. I'm a little suspicious as to what's going on. He doesn't feel rested, sleeps all night long, but wakes up fatigued. So people who have sleep apnea don't get into the deep REM sleep. That is the restorative sleep that we have. So we want to make sure that they do that. That's why it's important. Memory loss. Can't remember what they're doing or going, and he reported that. Poor judgment. Lethargy. He's hypertensive. Confusion. He complains of a headache. He definitely gained 50 pounds in the last year. Okay, so I'm going to put all of these up, Heather. I'm going to put this whole slide up for you. I will, I promise you. I just don't put them up ahead of time because it has all the answers on it, and then then all you're doing is reading the answers for me. I thought I would just put it on the front page. You know, on the opening page, I was sticking everything on that front page. Or I'll send it to you. I mean, I'll make sure you have it, okay? Okay, so risk factors. Obesity, a large uvula. Uvula is that dangler in the back of your neck, back of your throat. Well, we're going to talk about that in a minute. You get a short neck. People who have short necks are more at risk. Smoking, enlarged tonsils. It happens more in men than women and increases with your age. Risk with age. So, what tests will help the provider diagnose this obstructive sleep apnea? Sleep studies. Well, overnight sleep studies, where you're actually going somewhere to have your sleep study done, is incredibly expensive, and only some insurances will pay for it. But you can go, they do an at-home sleep study. So I actually had one done, so I know all about this. You don't have all the things wired up to your head, but you do wear a pulse oximeter, and it looks like a nasal cannula. It measures your respiratory rate. I was diagnosed with mild sleep apnea. So occasionally my husband tells me that it's more than mild. I'm like, put in your earplugs. Okay, so go away and somebody watches you sleep. A polysonogram is the gold standard, and then there's limited channel monitoring, and then also the physical exam. But typically you'll do an overnight study is done now, and they're going to get that diagnosis of sleep apnea. Physical exam also includes actually looking, you know, making sure that we have an open airway, there's not any polyps in the back of the nose or something like that that's causing the problem. So the primary care provider examined Sam and documented a long, soft palate, recessed mandible, and medium-sized tonsils. So he is a turtle man. And overnight screening showed 143 episodes of desaturation down to 68 to 76%. Now, let's talk about that. If that patient was in the hospital and that was happening, we'd be running into the room, right? This is going on 143 times a night. He's dropping to this point. So they said, yes, he has obstructive sleep apnea, and it definitely has hypoxemia, and we need to do a sleep study. So the healthcare provider says, counsel this patient on lifestyle changes. And what are you going to talk to Sam about? Weight loss. What else? Caffeine abuse. We know he doesn't drink, but not to drink because it increases drinking. What else? What other things can you do? When you're sleeping with somebody, next to somebody who is snoring, what do? Roll over, right? Snoring usually happens when they're on their back. Change positions in your sleep. Maybe new pillows. How do you get people from stop sleeping on their back? What does Iggy say? Anybody got a trick? Heard of any tricks of keeping people off their backs? You can't roll back on You can't roll back onto it. A trick is to sew a pocket in the back of the shirt and put in a tennis ball. Because people don't like to lay, when you are laying on something like on your back, it takes you off your back again. So that's a trick that has been used for a long time, is that you put something obstructive. So people, they roll onto their back and then they're not comfortable because there's a tennis ball, so they roll off. It's a trick. I don't know how effective it is, but I believe I read that in Iggy. Okay. And then we want them to avoid narcotics, benzodiazepines, and muscle relaxants.
Because they might need a diesel balance.
Well, they could. I mean, it's going to decrease their drive. Yes.
What, so say someone doesn't have the episodes of apnea, but they still snore, is that still considered a form of sleep apnea?
It's obstructive. No, it's not causing apnea, though. It's just obstructive.
Okay, but that's still an important thing to find out what someone's doing.
Well, there's a reason for the obstruction. So do they have nasal polyps? Do they have, yeah, are their tonsils enlarged? Or, yeah, it's worth checking out for sure. Because you want to rule out sleep apnea.
Probably advise them to do all these things.
Yes. So you want to elevate the head of the bed, of course. We pretty much elevate the head of bed all the time, right? Except that's not always the correct answer. Okay, so now Sam has done this miraculous change in age and ethnicity, but it's a good picture. He's age, ethnicity, and body type. So you're working in the emergency department, and the medics bring in Sam. And he says he fell asleep while he was driving to work and wrecked his car. His vital signs are in normal limits, his pulse of 92% on room air, and he complains of rib pain from the airbag release. And chest x-ray indicates he has a 65% pneumothorax on the right, and you put O2 on at 2 liters, and his sats rise to 96%. What do you think we need to do next? We need to put a chest tube in this guy, right? Yeah, I think so. So, insert chest tube video here. All right, this is where we do that. And I'm going to you're going to hand these out to everyone. This is just a little go along. Those are 2 different ones, 2 different sheets, okay? And maybe, because this is not a streamed video, that's why I'm showing it to you in class, but maybe it'll go on to this, maybe, our recording, so you'll be able to see it again. What do I want to do here? Right.